Health officials in British Columbia have confirmed the first known Canadian case of a highly mutated variant of COVID-19. The patient has not traveled outside the province. The case is raising some new concerns of another potential COVID surge. Chris Ensing is in Windsor, Ontario with the details. Good morning, Chris.
Good morning, Heather. Now, when we look at these cases that are starting to appear in a handful of countries across the world, what their big concerns are when we talk to health officials are really some of the unknowns about this. The officials in British Columbia, when they are announcing that this first case has been tested for this BA.2.86 variant, are saying that it doesn't change the risk of COVID-19 in that province, but it's something that they are keeping a close eye on. And a big part of that is because of the mutations that are occurring. 30 mutations from that original COVID-19 strain, all of this connected to Omicron, which is what created that big surge of cases back in spring of 2022 here in Canada. And the concern with this variant right now is the idea of how it might spread and how severe it could be. And part of that is because of the immunity that Canadians have built up either through vaccination or infection or both in many cases. But with these mutations in this variant, there's concerns that it might be able to evade some of those protections that have been built up. Here's what one medical professional is thinking about in British Columbia today.
It has 30 plus mutations in it, similar to how different Omicron had been initially. So that's, of course, the big fear. And with that many mutations, is there going to be a lot of what we call immune escape? So where it can not be affected. If you've been vaccinated, if you've had COVID before, that's not going to protect you if the virus is too different because of mutations.
Now, we can say that the person who tested positive is not being hospitalized. They have not left the province, and this was a case that popped up in the Fraser Health region east of Vancouver. Again, no change in the risk of COVID-19 in the province there, according to medical officials, but they are noting an uptick in cases, something we're seeing across Canada.
Yes, and something the doctors and health officials are warning of, uptick in cases and even in hospitalizations, including the one that's just behind you there, Chris.
Yes, Heather. In the 7th floor of the Windsor Regional Hospital, there has been an outbreak declared. That's because 10 people have tested positive for COVID-19. Now, that changes some of the policies inside of the hospital. More people will wear masks. Staff, patients, visitors are all going to have to mask off when they're inside there. Now, on Prince Edward Island, also an outbreak at a hospital. That's at Kings County Memorial Hospital in Montague. It's actually reduced the hours there of their emergency room, now closing at 4 p.m., asking anybody to go to Charlottetown if they need that kind of urgent care. One thing medical professionals are pointing out as this new strain is showing up in Canada, in British Columbia, is the idea that COVID-19 is still killing people. 30 people last week, according to Health Canada. It's about 4 people a day, according to the numbers that we've been looking at and that medical professionals have been warning us about as we keep an eye on how this situation is developing, Heather.
Chris Ensing in Windsor, thank you very much.